This is Healthcare Uprising. We are here to shine a light on the innovators implementing positive change in American healthcare and the patient experience stories, good and bad, that can help others navigate the sometimes overwhelmingly complex American healthcare system. Welcome to the Uprising. We are not doctors and we don't play one on TV. If you need medical advice, consult with your physician or a healthcare professional. All right. Hello, health heads. Welcome and thank you for checking in to this dose of the Healthcare Uprising. I'm your producer in the back, Jeremy Carr, here with your host in the front row, Heather Pierce. So what's on the agenda for today, Heather?
So today we're talking to Svetlana Kazantseva. She's a California-based entrepreneur and the founder of Strawberry Health, a health tech company empowering women to proactively monitor their hormonal health. She's a mother of two and the founder of two femtech companies. She's lived and worked in diverse locations such as Siberia, New Delhi, London, and California, and brings a unique global perspective to her work. Svetlana is passionate about supporting women, and she has established a thriving community of femtech leaders in the San Francisco Bay Area.
Femtech leaders. I love that. That's a great term. It's very anti-bro. Femtech, though. Yeah, sounds very steampunky in a way.
Hashtag femtech.
Yeah, hashtag femtech. All right. Well, I getting me interested to actually talk about menopause. That never thought I'd say that in my life. But without any further ado, here is our interview with Svetlana from Strawberry Health.
Hi, Svetlana. Welcome to Healthcare Uprising. Thanks for being with us today.
Hi, Heather. Hi, Jeremy. Thank you
Hello,
for
hello.
having me.
So we're just going to dive right into the questions today with you. And first things first, can you tell us a little bit about your background and your experience and really what ultimately drove you to establish and build Strawberry Health?
Totally. Um, I usually tell my story starting from my first company in women's health that I started in December 2020. And it was a company that was producing reusable menstrual products. And it was an interesting time to start that company. December 2020, we were in the pandemic. I moved to the United States from London in January 2020. So it was my first year in the United States. And I also had my second child in April 2020. So a lot of things were changing for me personally and in the world that drove me to seek for the opportunities to bring more impact. And initially, I was focused on reducing the environmental waste. That's why reusable menstrual products. But ultimately, I ended up working in women's health area and having conversation with women around me who started to open up about their personal experiences. It's very interesting how women are ready and prepared to share about their personal experiences with healthcare with other women once they learn that like we work in this area. And at some point during my period care company, I started an educational initiative with my team to educate our customers about women's health conditions like PCOS, endometriosis, and menstrual cycle, hormonal changes. And we also a great response. Like people were commenting on social media, people were replying to our email campaigns, sometimes even requesting to dive deeper into particular topics. And we decided to use this opportunity to launch Strawberry Health as a separate company to support women in women's health issues and in hormonal health.
Do you still have the original
The
company? Like, is it
original
still alive and
company?
well?
No, it's not. This year, I closed that company to focus completely on Strawberry Health.
Strawberry Health. And I have to ask you, The origins of the name Strawberry Health. Where
Yeah, yeah, it's a funny story actually. So my first company was called Plum Time. So plum like a fruit and thyme like a herb.
Mm,
And our team at Plum Time gathered for a team call, and we decided to do a 5-minute brainstorm to give the name to the second company. And there were different options, but one of the interns, a 16-year-old girl, came up with the name Strawberry. It was Strawberry Initiative. And we voted, and we all voted in favor of this option. It was somehow connected to plum time. Like it still continues this like fruit, herbs, berries theme. And we decided
mhm.
that it also is quite well fitting to women's health topic. So that's why it became Strawberry Initiative in the beginning and then Strawberry Health.
Got it. Thanks for
Mhm.
sharing. Sorry, I kind of
Of
might have thrown
course.
you for a loop on that one, but I have been absolutely curious since learning of Strawberry Health. So
Yeah, it now became a well-recognized name, and other people in the industry call us strawberry people.
Makes me think of the Beatles and the strawberry fields is what it makes me think.
Exactly, exactly.
It's
I've
a
been
great
playing this
symbol.
song.
Yeah,
Yeah,
that like any reference you can think of for a strawberry is a good thing, you know.
mhm. Yeah, it does
totally.
feel very feminine too. There's something about a strawberry that
Yeah.
just it has that female
Some of our
vibe.
customers share that it makes them feel more relaxed when they think
Oh,
about their health. The
uh-huh.
strawberry is a nice thing. It's nothing to worry about. So
Yeah.
we just decided that it's a perfect name to continue and to launch our product with.
Well,
Mhm.
I like it. Well, in this kind of same line of thought here, we're talking about, women's health. Obviously, this is a big focus of our conversation today, but women's health is having its moment, like 100 billion% right now, and I am so freaking here for it. It's what brought me to you. So thank God for my LinkedIn post and asking everybody, "Hey, what's your favorite female health focused company?" And boy, did that post go viral. But we really are having a moment. Why do you think that is? I mean, you've worked in the space for a while. You started with the Period healthcare company, and now here with Strawberry Health. What what is happening?
Yeah, first of all, it's very exciting to see women's health to be finally having a moment because we are so much behind when it comes to the healthcare gaps, gender healthcare gaps that we have, and the solutions that are now coming to the market, the research that are now like having some investments in is so much overdue. So I don't think we are actually going to stop there. It's great that there is so much more attention and more funding to women's health, but there is so much to be done. It's the need, the demand that is driving all the innovations and additional funding in this space.
There's a lot going on, that's for sure. So why don't you tell us a little bit more about what Strawberry Health does, a little bit more of the specifics about
Yeah, absolutely,
yeah.
absolutely. So for Strawberry Health, we are offering a convenient solution for women to test their hormones through self-collected blood tests from the comfort of their homes. So what we offer is a test kit that gets delivered to your house, to your workplace, whatever it's convenient for you to take the test. And we ask women to wait for day 3 of the menstrual cycle. So all of our customers, they do have menstrual cycle. That's the like requirement for participating in Strawberry Health testing. And they perform the test. It takes about 20 minutes in total with all the preparations, with using the device to collect blood. We use a very convenient device that is, you basically stick it to your upper arm, you press the button, there is a test tube, you collect a blood sample, you send it to the lab in a prepaid envelope, and you receive the results in the Strawberry Health portal. with the additional information, what this means. It's reviewed by doctors, and you receive actionable steps. How do I address any problems or any concerns that are detected? So that's the product offering.
Do you have doctors on staff? How does that work? Are they the ones that are reviewing and providing
Yes,
whatever the assessment
the
analysis?
ones that are reviewing, they are actually a separate company that are licensed in 50 states, which is great for us. So we are able to operate in 50 states at once. And they are both ordering the blood tests, because in the US, with the current regulations, a doctor has to order a blood test. And they are reviewing the results as well. So if there is something alarming, the doctor will call the patient to let them know. If not, then they will just pass us the results and we will display them in the portal for the customer to understand how their levels look like.
Hmm.
Yeah.
So you make the tests and they go to the independent lab for the actual result.
Yes, we do have a lot
Um,
of partners who are participating and making this possible.
do you mind if I jump in for a second,
Yeah,
Heather?
go for it.
Um, how does I mean hormones are I mean I'm such a layman in this, but everybody's physiology is a little bit different, right? Like everybody's hormone levels are going to be a little different. How do you know like a baseline to test against and
Yeah.
like what to actually do for each individual to actually get them to where they themselves are in balance? Is that a legit
Yeah,
question?
that's a perfect question, because the goal of our service is to help women understand their baselines. Just as you mentioned, Jeremy, they are all different. And our current healthcare system, even if we don't think that our current healthcare system is often ignoring hormones at all, when they look at our levels, the ranges are huge. Like you can be, as an individual, you can be at the bottom of a healthy range all the time and feel great. And the other person can be at the top of this healthy range and feel great as well. But if you've been at the bottom and you ended up at the top at some point, you may not feel that well. So as you continue testing annually or twice a year, you are building your unique baseline to understand like what you compare against.
So what's good for, I guess, hormonally, what's good for one person may not be good for another. Or heck, even maybe yourself, right? Because your hormones kind of fluctuate over time. That is that a fair statement? I don't I've never had
It
my
is.
hormones tested or analyzed. I probably should, and I'm past being a client, so
Yeah. I would jump back here a little bit and tell you how we came to this idea of building hormonal baselines. So my co-founder and I, we had a lot of conversations with women who went through perimenopause and menopause, and we were quite shocked by experiences that they had with hormonal fluctuations and not being able to address some of the very disturbing symptoms that came in the perimenopause period. And none of them had any idea how their hormonal levels looked like before they came to this stage. So they had to work with their doctors to work from the symptoms, to take the most concerning and bothering symptom and address it first, then to work with the next one. So the missing part here was the data set about hormonal health for these women before they entered the perimenopause stage.
and also too, thinking about health insurance in general, right? Sometimes it's hard to get tests for things when you can't prove a good reason why, at least to be covered by insurance.
Exactly.
So Strawberry Health, it And there's some valuable data, right? There's some valuable, that baseline information. I'm just thinking about myself, like, wow, that probably could have been really helpful in diagnosing, something going on. Um, or knowing, yeah, you know what, you are headed into perimenopause, or actually you're not. There's something else going on. And then you take this information into your PCP or your OBGYN or whoever is your primary, right, for that part of your
Yeah.
life or whatever issues you're having. And so you can take the data as a patient or what's the term you use for Strawberry Health? Or do you call them patients,
The
members,
community
clients?
members.
Okay, got it. So then you have this, you're basically armed with this hormonal um, information that then can help
Yes.
address potential symptoms or conditions that are somehow attached to those hormone fluctuations, issues, etc.
You are armed with the data and you are armed with the particular requests to your healthcare provider. Um, for women who experienced being like not being listened or feeling dismissed by healthcare providers, it's a big part of our offering that we become their advocates
Mm-hmm.
in terms of their health. So we do provide them data, but we also let them know. So these levels don't look great, or this ratio of certain hormones may indicate a condition like polycystic ovarian syndrome. So this is what you need to ask your healthcare provider for, the tests to address the condition or ultrasound or whatever is needed. Like women come to this appointments prepared.
So it can help with a lot of things and point out underlying problems and all kinds of things like that as well.
Exactly.
Okay.
I think also too is that women often don't know what to ask for either. And hormones, I mean, that's what a great place to start, right? If nothing else.
And your general health is kind of all based on it, right? Like it kind of your your hormones make your system run, and if they're out of balance, then your system doesn't run right, right? And like in essence.
Exactly, exactly. Like our endocrine system, we have hormonal receptors everywhere in the body. So some imbalances can impact a lot of areas of your health, from your bone health to your brain health, your muscles, metabolism. I'm not a doctor, but I know this from the doctors we work with. It impacts a lot of our
So
functions.
so I have a question that's also a big possible pitch for your company here. So people at like peak health, if you're in good shape, you should get one of these tests so you can put like your physiology on record, so to speak, with the lab, so that if something starts going wrong and you get tested again, you can see where the problem is. Is that like kind
That's
of
a
the idea
great
that we're getting at
approach.
here?
That's a great approach. So we would love to have women who are feeling great to test their hormones. Right now, what we see that some of the women, like most of the women, they already have some concerns when they come to us. I think as women, we always have some sort of concerns. It's either fertility related, family planning related questions. It could be some symptoms that we experience, and the underlying cause can be hormonal imbalance or a condition that can be diagnosed, and the first place is looking at hormonal balance. Or it's perimenopause, and when we enter our late 30s, early 40s, these days we already know that changes are starting to happen, and a lot of things that we start to experience can be tied to our hormones.
This is like very preventive care. Value-based care is like, very
Yep.
common, almost a healthcare household term. Nowadays, a lot of companies, organizations, startups are really focused on delivering value-based care, models of care. And to me, getting in front of that and getting those hormone, like Jeremy, what you suggested, your great pitch, like this is why we're going to do this. Um, that makes sense. And that's very aligned, I think, to being more proactive versus reactive.
Yeah,
So, yeah, there you go.
And an ounce of prevention is a pound of cure, right? I
That's a
kind
great
of
one.
look like the guy that said that right the first time.
It is true though. Yeah. I mean, preventive care is everything, but it's still hard. Like going back to what I said earlier, not to, to get it covered by insurance and who knows how much
mm-hmm.
it's going to get, how much you would get charged for a
Mm-hmm.
hormone testing panel or whatever they call it. Again, I haven't had one, so I'm not even sure, but mine would probably be pretty scary, is my guess. But then you can go. So one of the things I wanted to ask you about. Now you're very consumer focused, I would say, consumer
Mm-hmm.
focused company, right? You're going direct to consumer. You're not contracting with health plans or Medicaid or Medicare or anything like that. It is. Can you talk a little bit about what your, I guess your delivery model is at this point, or your
Yeah,
channels of bringing on clients and
yeah,
community members?
yeah. Yeah, we decided that our first channel would be direct to consumer. We already have a community of women, over 5,000 women who are concerned or interested in their hormonal levels. It's a great start to give them the opportunity to take control of their hormonal health. And we see a great referral rate as well. So women are not only like, taking this test, but they are referring their friends to take this test. And as you mentioned, additional channels are totally possible as we move forward. There are so many opportunities where this can be used, where this can be helpful. It could be workplaces that want to support female employees because currently a lot of female employees they just leave the workplaces after 40, 45 years old because they are not suited to support women going through hormonal changes. Healthcare providers can totally offer this service to their patients as a preventative measure, as a way to cover their lack of training in hormones, because currently physicians they receive about an hour of training in hormones, and it's mostly menstrual cycle related. Like they just learn how hormones fluctuate throughout the menstrual cycle. And yeah, so there are a lot of gaps in doctors' training as well that can be improved by implementing the service like Strawberry Health.
We hear this a lot with all the different folks that we've been talking with on the podcast because we've had a chance to speak with a number of startups focused on female health, and that is the common thread, right, Jeremy? Like
Yep.
physicians, providers, whoever, they're just not trained.
Just lack of training, lack of focus. Nobody, it's like it's a footnote.
Yeah.
Doesn't even get a whole page. It just gets a footnote.
Hmm. Hopefully that's changing.
Well, it is. That's what we're here doing on the Uprising is we're spotlighting it. I mean, this episode today, this interview right here is a step towards changing that, right?
Let's hope
And we
so.
have a whole series on women's health coming
Yeah.
through.
We
So
do. There's so many topics. And one of the things I want to ask you too is that you're obviously like probably pretty uber focused in the hormonal health space. So are you seeing or hearing any trends? I mean, obviously, like we said earlier, female health in general is having its moment, but are there any specific trends, good, bad, or ugly, that you're seeing in the space that you can talk about that like let us know what's happening.
Yeah, yeah.
Hopefully
I
good
would
ones.
say I would say I see two sides of this. One is the consumer requests and consumer demand, and the other is what companies offer. From the consumer side, it's very exciting to see women who finally want to understand what's going on with their health and be in control of that instead of just being told by their doctor like what they need to do and how they should feel. So all of the wearable devices like Aura, all of the services that allow us to gather additional information about our sleep, metabolism, like how our body processes like fats, sugar. It's very exciting to see that consumers are more interested in this. But from the side of the companies, I see a lot of personalized approaches. So we no longer try to feed everyone like in the same box. Companies understand that everyone is different. Everyone has their own feeling great state, their own baseline. So they also offer more opportunities for people to collect this data and build their baselines.
Hmm.
There you go. Yeah, but the baseline seems like the important part to me. If you don't know what normal is, then how do you know how to fix what's wrong, right?
Exactly.
Yeah.
Oh,
I was having a thought too, a few minutes back, and I want to and I want to share it now because I was thinking about kind of the convenience of the test, that Strawberry Health offers doing this blood test at home. We're seeing a lot more of that, right? Like these kind of in-home testings. I think they're COVID, as icky and terrible as COVID was, there are some good things that have come out of that. And I'm thinking about COVID testing, like the at-home COVID
Mhm.
testing. We've gotten used to like testing ourselves for things, literally, because my half my family had been sick for several weeks, and we thought, my gosh, is it COVID? And I thought, well, I'm just going to go grab a test from the store. And now we can do it, just kind of like nothing and take the COVID test. And it's about a 15-minute, investment. We still got to follow the instructions. Like, how do we do this? Like all those things. But I can't help to think though that there were some good things that have come out of the pandemic. And it is like these at-home self-testing is more, not that they didn't exist before, but now they're more common. The technology is certainly there, and people are generally more comfortable with the idea of doing this. And I don't know, healthcare has never been very human friendly. And I think for the first time, it's actually making that shift. I don't know. What do you think about that? Does that feel
Yeah, you raised a great
right?
point that COVID changed the experience and our expectations as consumers, as patients. We got used to getting care while being in the comfort of our homes, being in control of the procedures that we do, self-perform them. And now the expectation is that we should be able to get tested, to get certain health checks without spending half of our day driving to a hospital, looking for a parking, waiting in the waiting room. So yes, totally. We now have another sort of expectations, another level of expectations, and the at-home tests are definitely something that we consider as a new normal after the pandemic.
Yep.
yeah, it's popping up for a lot of things, really. So,
Hmm. Yeah. And
I mean,
we're
they have self-prescribing glasses stuff now. I saw a commercial for.
oh,
I'm not even sure how that works, but
Sounds
okay.
cool.
yeah, I mean, there's all kinds of like do it yourself at home healthcare things popping up that I've seen.
Yeah.
We'll have to start a list of those. Maybe that's another theme we should follow for a while at some point on the podcast here.
Well, and one of the biggest challenges that we have, particularly in rural America, is shortage of providers, and needing to travel. So the more at home, the more kind of, self-administered, very consumer patient focused healthcare in terms of access and, just kind of ease of use. I mean, the more we can have of that, the better. And technology, the reason this podcast exists, basically, so we can talk to all the awesome, brilliant people who are doing stuff like this. The more of that, the better, I think. It's just the industry is shifting, and I don't know, I'm here for it.
Me
Totally.
too.
Yeah. So, in terms of what you're doing with Strawberry Health, I don't know if you're able to share any I would say even like a anonymous member testimonial, any kind of positive outcomes or stories that you can share that Strawberry Health has seen, or the people using your blood test. Like, did they take one of these at-home blood tests, and then all of a sudden they were sent forth on a positive pathway of health that maybe wouldn't have happened otherwise?
Yeah, great question. So for the transparency, we are currently in the beta with our first group of customers who are getting their tests. Like all of them received their tests 2 weeks ago, and we are starting to receive the first results. So far we were able to track their experience with like receiving the test kit, performing the blood test, and it's already pretty interesting. So what we heard is that women who were scared of the needles, or scared of going to doctors to have blood drawn, they found the experience of self-collected blood tests being fun by following our video instructions and step-by-step guides, which is already a win. I'm myself not a fan of blood drawn. My co-founder, she's fainting when she has her blood drawn. So that's a small win for a lot of people who found this experience troublesome. But we also hear that just this step of ordering a hormone test makes women feel better, that they are taking care of themselves, that it's an additional step that no one would think about apart from them, like no one would do it for them. So it becomes a part of the self-care routine for people already.
I love that.
Yeah, it gets them to be more proactive about their own health care. And
Mhm.
that's great. Like people who hate going to the doctor and afraid of the needles and the whole process is just kind of disturbing, which I can totally relate to. Uh, yeah, being able to just do it yourself at home and mail it in and okay, tell me what's wrong. And then if you do have to go to the doctor, you can at least know what you're going in for and be like, hey, this is what's wrong. Can you please fix me? And not have to go through all the tests with them there.
Yeah,
It saves a lot of money too, I would bet.
which we need
Yeah,
to
yeah.
do in this world, especially in terms of costs of healthcare, right? I mean, we
Yeah.
know those it's expensive to not be well.
In this country, it very much
That's
is.
true.
Yeah.
Yeah.
Yeah, one part is the cost. The second part is, as you mentioned, the experience.
Hmm.
We have a lot of experiences that we cannot describe as positive when it comes to healthcare. So even small steps that can be taken to improve these experiences. For women specifically, this is important for us because we know that women get not the best treatment. Usually, a lot of concerns are dismissed. This is just what it is.
Hmm.
Um, it's very important to being able to change that one step at a time.
Yeah. Well, I love that you're a part of
Right.
it. It's it's exciting. So you have the beta test group. So we've just started collecting, you said, results back on that. So that's a big step for the company, obviously. Are What's next? What's coming down the pipeline for Strawberry Health that you can share with us that we can celebrate a little bit for you?
Yes, next year in February, we are launching to the public. So anyone would be able to go to our website, complete the questionnaire, and order their hormone test, which is a big step for us. And we are doing everything right now to prepare for it. We'll do a little redesign of our brand identity. We will make sure that our first customers received the best experience and they were able to efficiently follow up with the concerns that were detected. So we are setting ourselves up for success with the public launch. And yeah, all of the 2025 is going to be dedicated to growing our direct to consumer offering, our referral program, making sure that women receive their experience that is different from what they're used to.
I have to say, speaking from experience, and I'm sure you know this, Svetlana, that women talk to one another. We love community. We like
Yeah.
to nurture each other. And I think word of mouth, especially with something like this, is huge. Like I started with MIDI Health about 15 months ago, and I have since, through the power of referral and me talking about it, I think I've gotten at least 3 or 4 women. Um, lined up with MIDI Health as a patient. So and I know that you're probably pretty well connected with those folks there. They're part of obviously leading the charge for female healthcare for sure. They're definitely getting some traction and Strawberry Health I think is going to be going to be it if not already a big part of this movement.
Yeah,
Yeah.
yeah. We are hosting some events here in the Bay Area for fem health, femtech folks.
Hmm.
I know Midi, I spoke to Joanna. They are amazing what they do. I really love that. So this is exactly what we need. They are changing the experience for women when it comes to perimenopause and menopause care. So we actually feel listened to and we get our concerns addressed. Also, like the topic of telemedicine is in line with at-home tests. This is
Hmm.
the new standard that we expect, like being able to receive care from anywhere. Yeah, it's
Yeah.
very exciting to see great companies rising in this area.
You mentioned the events in the Bay Area and also femtech. I know, again, since my LinkedIn post, all of a sudden, my world just kind of blew up in the female tech space. I feel like I'm part of the crew now, which is really exciting.
All right.
I got adopted in, because I've met such really amazing people. Are there any events that are coming up that you'll be at, either speaking? Are you an exhibitor? Like somehow, like share that with us so that we can include that here, obviously in the podcast, but we can put it in the show notes as well because I think some of our listeners will be interested in these events.
Yeah, totally. I do have some on my calendar for January. I think Coyote Ventures, which is a VC focusing specifically on women's health, they are hosting an event on January. I think it's 14th, but I need to double check. I would be
Hmm.
happy to share the link with you.
Yeah.
Yeah, we will be hosting an event probably closer to March, like
Okay.
to around the time of our launch, like spread the word with the community that Strawberry Health is available to everyone now. Um, what we also do is we are hosting smaller events for professionals in women's health area, doctors, founders. Sometimes we invite investors as well to participate in the conversation. So if any of the people happen to be in your network who fit this description, we would love to have them at our branches, which we host once every 2 months.
Oh, okay. Wow.
Oh, there you go. So there's an ongoing series that people can jump in on when they can. That's good.
Yep.
I love it. Well, this has been absolutely fascinating. I love what you're doing. I wish I was not past the point of being one of your members, but I think I might be, unfortunately. I'm like I said, I'm more in the and I'm by the obviously I have no problem talking about this. Um I'm pretty open. I'm a pretty open book when it comes to this like whole women's health thing. Because I think it's kind of crappy that our moms and our grandmas didn't talk about this stuff because now
Yeah,
there's a bunch of women in our 30s and 40s and 50s that are like, "Hey, we're going through menopause. Like this is a real thing." And or my hormones are all over the place, or I have PCOS, or I am infertility issues. It's like no one ever talked about it. So I'm here
exactly.
to, I'm here to use this platform as well, just to, I think, share that I too have my own issues, right? Like I'm going through this, and I get it. Like I have empathy, but yeah, I'm a little bummed. I don't know that I'm ideal, but I still need to know what my hormones look like. They're, like I said, they're probably pretty whacked right now, but
And actually, that's a question that you pop into my brain. So your test is focused specifically on menopausal hormone levels. Do you have,
or pre, right? Before,
I'm
because
sorry,
Pre,
pre,
yeah,
or
yeah,
but so what she's talking about, like later on, like for older women who are past that, but still have, menopausal or hormonal imbalances.
mhm.
Does your test cover stuff like that as well, or is it specific to the case?
Yeah. So the thing about our testing is that it's a snapshot of hormones taken every 6 months or every year. And it only makes sense to perform when you still have a regular menstrual cycle, when you can still have day
Oh,
free
that's
of
right.
your
Okay.
menstrual cycle to compare these levels to.
Gotcha. Gotcha.
Once once we enter perimenopause and hormones start to fluctuate like throughout the day, every day, it's so unpredictable that taking these snapshots is not really going to help. You need to monitor
Gotcha.
it continuously if you want to make sense of your levels.
That was a good reiteration for me. Thank you. That locked it into my brain a little better there.
Jeremy, you're gonna know all about female healthcare soon enough, and you'll be a
Hey,
pro.
I love
that's
learning new
great.
things every day. It's when you get as old as I am and you're still looking for something new every day, you don't know where it's going to take you.
It certainly gives you new perspectives because you communicate with women of all ages in your life, and so you're able to understand what is
Mhm.
actually happening from physiological perspective that may drive their behavior. I guess that's
Yeah.
the benefit.
Mhm.
I just recently learned there's a male menopause.
Hmm,
I'm looking forward to that episode so I can figure out what's wrong with me.
I would love to listen too.
Men have cycles
That's a real
too.
thing. Like our hormones go like it's like a second puberty that your men, I guess apparently I like I said I just recently learned this concept that men go through a similar, I mean it's not as extreme obviously, but we do have this change that we go through and some men it affects greatly. Like the grumpy old man thing
Oh,
is
yeah.
actually could actually be just male menopause.
Hey, possible.
Yeah.
Well, we're gonna make
So
sure we cover that in a future episode.
yeah,
So,
I'm gonna make sure that stays on the list until it's covered.
I would love to learn about that.
well, we've covered a lot today. I really appreciate you coming on and sharing all of your wisdom and your experience and what you're doing with Strawberry Health and being such a, a big part of this kind of progressive women empowerment in healthcare. I love it. I love that you've joined us today. So, before we leave, though, I would love for you to share with us how do we find you online, social media? Where are you? Obviously, we talked a little bit about those events, but what's the easiest way to get a hold of you?
LinkedIn. I'm very active on LinkedIn, posting about women's health, about our progress with Strawberry Health. I'm proud to be publicly building this company, so I do update my network when we hit exciting milestones. I've heard that it's helpful for other entrepreneurs. Also, Strawberry Health page on LinkedIn. This is where you will find educational content on hormones and our official announcements about the launch. Um, I would say that's the main platform to look out for if you're interested in connecting.
Great. And just as a reminder, too, I want to reiterate this before we sign off, is that you're in beta test mode right now, but you
Yeah.
will be launching to the public. So anyone will be able to say, hey, I want to get a hormone test through Strawberry Health in March. Is that what you said?
February, our goal is
February.
February, the second part of February.
Okay, so second half of February. So what we're going to have to do is we're going to have to bring you back on in like a year or 6 months or something like that once you get it
Absolutely.
out and go bigger. And then you start getting some of that data coming back in. I would love to have you come back on and hear about how things are going and how Strawberry Health is just killing it. So
Totally, totally. We are
I would
set
love
for
that.
that
Okay, all right. We have a future date TBD, but it's gonna happen.
for
Awesome.
sure.
Awesome.
Well, Svetlana, thank you so much for joining us today. This has been absolutely enlightening. Even for me, I'm still learning every day about my own health. So this has been really exciting and inspiring to have you on.
Thank you
Yeah,
so much for having me, Heather and Jeremy. It's such a great podcast, bringing different perspectives about women's health. We all will learn something from your podcast, I'm sure.
all right, there you go, health heads. That's our interview with Svetlana from Strawberry Health. Found that very interesting. I know more about hormones now. I know more about menopause than I ever thought I would already. And we're just starting down that road. So this is going to be a very interesting podcast, let me tell you. But what are your main takeaways from today's interview there, Heather?
Well, I think just taking a more proactive approach to your health. Truthfully, whether you're female or male, although we were focused obviously on female.
I did
Uh,
put it on the list, though. We're going to do the male menopause episode at some point.
yep, it's coming. But yeah, for especially for women and just really taking a hard look at your hormones and how they affect or drive your health for good or for worse. And really, what they're doing here with Strawberry Health is a more preventive approach to female hormonal health. And I think we should probably all get on that bandwagon. So
Yeah.
yeah, that's the big. I think that's the number one numero uno.
But on that note, if you enjoyed what you saw and or heard today, check us out at patreon.com/healthcare uprising to become an official member of the Uprising for as little as $1 a month. Gets you early access to all our pre-recorded interviews. We tend to be a couple months ahead or so of public release. And that's also going to be our place for all our community chats and things like that. So if you want to get in on the post-episode conversations and whatnot, really join the community. That's patreon.com/healthcare uprising. Also, you can find us on all of the major listening platforms, your Spotify's and Apple podcasts and iHearts and things like that. And as well as YouTube, just search Healthcare Uprising.
Awesome. And you can find us online at healthcareuprising.com as well. And of course, on all the social media platforms, including LinkedIn, Instagram, Facebook, and Blue Sky. Just search Healthcare Uprising Podcast and you'll find us pretty easily. But also, if you have a story to tell, a new product or a business we can learn about and share with the masses, or even just a question for us or one of our interviewees, shoot us an email at healthcareuprising@gmail.com. So that's it for this dose of Healthcare Uprising today. Until next time, keep looking for the good in the world. Sometimes it's where you least expect it.
This has been a Shut Up production.